Away from loans and borrowing, news that a child has been diagnosed with cancer can be devastating, especially to the child's parents and immediate family. However, survival rates for childhood cancer patients have greatly increased globally in the last decade due to improved diagnosis and management. KTN's Mary Mwoki brings us the stories of 3 children who have found a new lease of life at the AIC Kijabe Hospital's pediatric wing following the cancer diagnosis.
We meet 3-year-old Joseph Karanja at the pediatric wing of the AIC Kijabe Hospital. His father is lovingly feeding him. When Joseph fell ill, his parents took him to various hospitals seeking treatment for him, but could not get a proper diagnosis. They finally came here where he was diagnosed with cancer that affects the lymph nodes.
Wakatuambia, toka kwa rabu atatuambia. Saa hiyo mama ndiye alikuwa na mtoto. Akanipigia simu akaniambia ameambiwa mtoto ni kansa ako nayo.
So what he has is called non-Hodgkin's lymphoma. He has been on treatment so far. He's just over halfway of his treatment on the 5th cycle of chemotherapy, and that is the 5th out of 8 cycles.
Joseph was immediately put on treatment. He was to undergo 8 cycles of chemotherapy. He successfully underwent 4 cycles, but it was the 5th cycle in early May 2019 that nearly cut short his young life.
Ilikafinya kabisa, ikabidi turudi. Kurudi kakapelekwa HDU.
At the high dependency unit, it was a race against time. Doctors did everything medically possible to save his life, and when that was not enough, they rolled up their sleeves to give him life. Literally, they gave their own blood.
What we did is just walk around our ward and ask clinicians and nurses and the people who ended up actually volunteering. We had 3 nurses, we had 1 clinical officer and 1 of our security guards who literally were just on duty, coming to the end of their shift, and when they heard that there's a child who needs blood products, they volunteered.
Ajok Deng comes from South Sudan. He was referred here because the prevailing political tension in his country makes it difficult to get suitable medical help for his child. His 3-year-old son is admitted at the HDU due to complications arising from chemotherapy. His son has a neuroblastoma, cancer that affects some of the nervous tissue.
In Pangak, where he was, there was a doctor that saw them there that told him that the child has a tumor.
Samuel Mutembei from Meru is a 10-year-old boy whose fighting spirit can be equated to the biblical David. Samuel was diagnosed with osteosarcoma, cancer of the bone. Unfortunately, by the time he was brought in, the cancer had progressed and his limb had to be amputated. But even that has not put the young boy's spirits down. He is out for some playtime before he can begin his 3rd cycle of chemo that will last for 24 hours.
Nakaa naye hapa 4 days, anachukua hiyo dawa ya chemotherapy, then tunarudi na nyuma.
Having a dedicated pediatric oncology unit greatly improves the management of cancers in children. Here at AIC Kijabe, children with cancers and their loved ones are assured of not just quality healthcare, but service with dignity and compassion. The AIC Kijabe Hospital has a devoted team of pediatric oncologists who selflessly exert themselves every day to make a difference in the lives of the children they deal with. Dr. Sarah says the survival rates for most of them have greatly improved.